Florida is one of the states now struggling to contain the virus. Yesterday, they reached 250,000 cases. The same day, Disney World officially opened up 2 of their parks. One more example of the tension between reopening the economy versus the threat to Americans' health. Advent Health is the biggest hospital chain headquartered in Florida. Terry Shaw is its CEO, and he joins us from Orlando. Good morning to you.
Good morning, Margaret.
So you have about 30 hospitals in the state of Florida. In other states, in Arizona and Texas, there are these reports of morgues being close to being overwhelmed. Are you at that point in Florida?
It's a very stressful time in Florida, Margaret, but no, we're not at that point. I'm thankful that we've had several months to learn how to treat the disease. We're much better prepared in July than we were in March. We have adequate personal protective equipment, we have a stockpile of ventilators, and we have an amazing clinical team that have taken best practices from around the globe and put them into our treatment protocols. And I'll give you an example. Our length of stay in our ICU for COVID patients has dropped in half. The number of people coming in to our hospital with COVID that need a ventilator, we've also been able to cut that in half. And because of those things, our death rate has also been cut in half over that time period. This disease is only 7 months, and our clinical team has done an amazing job determining how to care for people better today than they were just even 3 months ago.
Well, the state of Florida has only just this Friday started reporting officially hospitalization data, but you know what you're seeing in your own facilities. So can you tell us, based on what you know, when you think the peak of hospitalizations will be?
Based upon the testing, my guess is that the peak is sometime in front of us in July, and that would assume that people do what they need to do from both a distancing perspective and from a masking perspective to slow down the spread of the virus. COVID gets passed from one person to the next, and we can all do a better job making for sure that we're caring for one another by just wearing a simple mask and staying 6 feet from a distance perspective from the next person.
So I'm sorry. So from what you are laying out, do I hear you saying that you currently have enough supplies, PPE, you have enough medical staff to deal with the surge that you say is still in front of you?
Yes. So March and April, we spent an enormous amount of money on PPE, and we continue to have stockpiled PPE that we so desperately need right now. And so no, we are not short on PPE. Remdesivir is also coming in. We just got a shipment in from our state government this weekend. We were running low last week, but we have enough of that to continue to care for people. Our ICU capacities are running at about 85 to 90%, but we have the ability to turn some of our progressive care units into ICU units if we need to do so. Also, as a multi-state system, we're working with one of our sister states in Colorado, where we have facilities to bring clinicians from Colorado to Florida to help us staff up if we need to on an ongoing basis.
I wanted to ask you specifically about that, because back in the spring in New York, you saw that happen with medical personnel really being the thing most in demand and coming in from out of state. Are you calling for that? Do you need more personnel? Specifically, what do you need? And on remdesivir, which you just said you're about to get more of, how much supply do you have? How long does that last?
So the remdesivir that I'm just talking about, we got in this weekend, and we're supposed to get another shipment in this week. And at this juncture, I think we have enough as a system across our 30 hospitals to care for the people that would be coming in to one of our facilities for care. Relative to staff, it's very important that you have the ability to move staff around your state. One of the things that we did back in March was develop and program a staff redeployment program that allowed us to move critical resources around our organization both within the state of Florida and then move people outside of the state of Florida to Florida or vice versa based upon where spikes were coming and where people would be needed the most.
I was looking at some of the state reports on ICU capacity at your different facilities across the state. Disney World's in Orlando. as many Americans know, or the Orlando area. And they reopened yesterday. I know your company has been hired by them to help advise on opening safely. But when I look at ICU availability in that area, it's pretty tight. Is it a good idea to open theme parks?
So as a healthcare provider, my job is to help people do things safely. Whether it's NASCAR or Disney, we have strategic alliances with those organizations, and we work very closely with them to help them determine a way to reopen and do that safely.
Okay.
I will tell you, based upon the way Disney is approaching this, with limiting people in, doing all the screenings that they're doing, I personally am a Disney season ticket holder.
Yeah.
I wouldn't hesitate to go to Disney as a healthcare CEO based upon the fact that they're working extremely hard to keep people safe.
All right. Thank you very much. Good luck to everyone working in your hospitals. We go now to Westport, Connecticut, and former FDA Commissioner Dr. Scott Gottlieb. Good morning to you.
Good morning.
Last Sunday when you were with us, you said we had 4 major epicenters of spread, and you predicted we would get to about 60,000 infections a day. That's right about where we've been for the past at least 3 days. You said within 2 weeks we'd be at 1,000 infections a day. 1,000 deaths a day. What do we need to be prepared for next?
Well, look, I think things are going to get worse before they get better. There's some private modeling floating around that shows that this is possibly going to peak in the next 2 or 3 weeks. You see Google mobility data and open table reservations starting to decline in these southern states where these dense epidemics are happening, which is an indication that consumers are pulling back. And that's going to create somewhat of a backstop. But I think what you're likely to see in the South, which is different than New York. New York really followed the pattern of Italy, where it was a sharp up, a huge epidemic, but it came down rapidly. I think in the South, you're likely to see an extended plateau. We really don't have a national approach here. What we have is state approaches that are creating regional effects. And so those regional effects are different. The New York experience mirrored Italy. I think the Southern experience is more likely to mirror Brazil, where you're likely to see more of an extended plateau once we reach that apex. And you could reach the apex in the next 2 or 3 weeks.
The next 2 to 3 weeks, which is the same time frame the Surgeon General referenced there. But when we talked to you throughout this pandemic, you had been warning, take New York as a lesson on what you need to be doing. It was a message to other governors for PPE, for preparing to get ahead of this. Why do the southern and western states not appear to be prepared?
Well, look, I think that they felt they were out of the woods after that first wave passed, but this has really been a regional experience in the United States. And what happened was they reopened against the backdrop of what was a lot of spread. They hadn't really crushed the virus in those states. And people became too early, in my view, and people became complacent, especially younger people. They were going out, not taking precautions. Older people were taking precautions. They were protecting the nursing homes and the vulnerable. But inevitably, what happens is if the younger people go out and get infected because they're not taking those precautions, it's going to get back into a more vulnerable population. And that's what we're seeing right now. You're seeing rising cases in nursing homes. Positivity in these states is actually declining in the younger population, but rising in the older population. And if you want sort of a proxy for that experience, you look at Iran. Iran had a major epidemic. It came way down. They had a second peak. It was mostly in younger people. They said, don't worry, it's younger people, so we're not going to see the same level of deaths. But eventually, the infection seeped into an older population. That's what's happening now. You're starting to see more outbreaks in nursing homes. So tragically, we're going to see deaths start to rise. And that's why I said 2 to 3 weeks until you see deaths get back above 1,000.
You've spoken before about this question of whether the virus is spread through aerosol transmission. And now we know the World Health Organization is looking at it. Should offices and schools be changing their filtration systems?
I think this is something they should look at. Remember, it's not binary. It's not either airborne or droplet transmission. This could be spread primarily through droplet transmission, but in certain settings that are very conducive to respiratory spread, you get something that approximates airborne transmission. And what are those conditions? It's enclosed spaces, spaces with recirculating air, air-conditioned spaces where it's cooler and it's more conducive to spread. So in optimal conditions indoors, you might get the kind of spread patterns that approximate airborne transmission. And in those settings, we should be thinking about trying to improve conditions, putting in HEPA filters, putting in UV light in the air conditioning systems. I think these are things you should be looking at. And in fact, many businesses are doing that. They are looking at retrofitting air conditioning systems. In some cases, it's not very expensive to do that. In other cases, it might be more expensive.
Well, perhaps that's something we should ask about with schools. The education secretary on another network said this morning that there is a lot of data to suggest that kids are not spreaders of COVID-19. She was talking about putting kids back physically in a classroom 5 days a week. In your medical opinion, is that data definitive and is it convincing?
Well, look, the data isn't definitive, but it's certainly suggestive. And what we've learned from this virus is it's surprised us. We've both underestimated it and overestimated it at the same time. So we need to be prudent. I think it's important to give discretion to local districts to take steps to try to de-densify schools and protect kids so we don't have outbreaks. Everyone should be working to reopen the schools. It's critical. And when I talk to Republican and Democratic governors, they're in fact doing that. But I think districts need discretion to try to put in place measures to keep kids safe. No other country, with the exception maybe of Sweden, reopened their schools or kept their schools open against the backdrop of so much spread that we're attempting to do in this country. So we do face a unique risk. And while the balance of the data shows that kids are less susceptible to infection and less likely to transmit it, less susceptible doesn't mean they're not susceptible. And sometimes, and some of the studies show that they can compensate for their decline in susceptibility by their propensity to spread infection, by their behaviors that are more likely to propagate infection. And one final point here. You know, if we look at the 2018-2019 flu season, 11.3 million kids became symptomatic from flu that season. There were 480 tragic deaths. We have not seen 11.3 million kids get symptomatic COVID yet because we've largely sheltered the children, and we don't want to see it. We've got to take measures to make sure it doesn't become epidemic in children in the same way that flu becomes epidemic in children, because we don't know what the impact's going to be on kids. Right now, the kids have been sheltered. I would guess that the infection rates among children has been relatively low in this country.
All right. We're definitely going to talk to you again about that. As you said, we don't know with kids. So it's something we'll be tracking as the science develops. We'll be right back with a look at the challenge faced by working parents of young children, childcare. We go now to Tom Wyatt, the CEO of KinderCare, a company that operates about 1,500 childcare and early childhood education facilities in 40 states. He joins us from Seattle, Washington. Good morning to you.
Good morning, Margaret.
I want to ask you about some of the lessons you've learned, but just right off the bat, I see that there have been reports of clusters of COVID cases in some childcare centers in Charlotte, North Carolina just this week. Out west as well, there have been some. How does KinderCare handle outbreaks like this, and how many have you seen in your facilities?
We've seen a few. What we do, let me take you through the health and safety process. We keep children in one pod. We keep them in one classroom. We feel that that's very important because we don't want to have people be exposed to different people, different teachers, what have you. So we keep them in pods, and by doing so, we have two forms of, if you will, generation or transmissions. One is if we have one case in a center, we'll close that center for 72 hours. We will disinfect it, then we will reopen it. If, in fact, we have more cases than that, we will actually close the center for 14 days. We have closed in the last 3 months. We've closed about 70 of our centers for 14 days, and we have closed 120 of them for 72 hours. And we feel like that means that our process is working, our protocols are working, which we work very closely with the CDC, and candidly, we are above what their requirements are because we actually feel very strongly that we're taking care of the most precious asset a family has.
I'm sure every parent would agree with you in that. But specifically, what does that mean? What kind of protections are you giving your staff? Are you testing them? And if so, how regularly? And is there any data that you have that shows that kids are spreading it or not spreading COVID?
We have no data to say they're spreading or not spreading it. As far as what we do, all of our teachers wear masks. All of our teachers that are in states that are offering essential workers testing, we encourage them to do so. We actually gave shields to our newborn and infant teachers because we wanted the children to actually see the expressions of their teachers because they connect that way. We do a temperature check every time a child comes to the center every single day. We also have a questionnaire for the families to fill out. We don't let families take their children back to the room. We actually have a teacher that will come from that pod to escort the child back to that room. As I said, the children stay together. We sanitize the playground equipment, every single pod that comes in. And when the children take naps during the day, we actually position them in a way that they're actually 6 feet apart. So all in the preservation of health and safety.
So McKinsey says about 27 million workers, 16% of the workforce is dependent on childcare in order for them to do their own jobs. But we know there are lower income workers who have frontline jobs, and it's difficult to afford childcare. Even at a facility like you're saying, you are trying to keep open.
Right.
What is the solution to this, since it is part of reopening the economy? When you talk to people in Washington, are you suggesting that Congress provide subsidies to childcare? I mean, the federal government doesn't do that for early childhood education.
Very, very good question. Let me tell you a couple of things that we are in conversations with Congress on, and we feel like we'll be a part of, we hope, will be a part of phase 4 when they return on the 20th of July from recess. Two things that we've asked them for is we are operating at a compromised state. State mandates have been a certain number of children in a room, much less than we've had in the past. Our centers, given those mandates, can only get to 45, 50% of their capacity, which candidly, we don't make money at that rate. So we need to relax those over time and when it's safe to do so. So we've asked for a rebound grant fund, and that fund is for the next 6 to 9 months. We're asking for between $25 and $50 billion to help us get through the additional cost of PPE, the additional cost of training. We have more labor in the center than we had pre-COVID. We have a dedicated ambassador for health and safety, which is additional headcount, and all of that with less than 50% of the children that we had pre-COVID.
Well,
that's one.
Yeah.
I didn't answer your question.
Well, I'm sorry, I have to leave it there, but we will be tracking what happens with you and childcare on this program ahead. Thank you for sharing your insights, Tom Wyatt of KinderCare. We'll be back with some politics in a moment and how the virus is impacting Campaign 2020 in those hotspot states. It's just over 100 days until Election Day. And this morning, we have a new CBS News Battleground Tracker out that looks at the presidential race in 3 states heavily impacted by the coronavirus. That's Arizona, Texas, and Florida. Results show former Vice President Joe Biden will be competitive or better in all 3 states. Mr. Biden and President Trump are tied 46-46 in Arizona. President Trump is up 46 to 45 in Texas, and the former vice president is up by 6 points, 48 to 42 in Florida. CBS News Elections and Surveys Director Anthony Salvanto joins us from his home this morning in Westchester County, New York. Good morning, Anthony. Good to have you back.
Good morning, Margaret. Thank you.
So these states are heavily impacted by the virus itself, but is that influencing votes?
In a short answer, yes. And here's how. First, for some context, we asked people if their state reopened the economy too quickly or at the right speed, and a majority in all of them said they thought their state went too quickly. And then they also told us that they felt that the state did that because of pressure from the Trump administration. So you combine that with the president's low approval for handling COVID in these states, and he may be paying something of a political price, at least for the moment there. And then the other thing that struck us is that people in these states are concerned about getting COVID. And the more concerned that someone is, the more likely they are to say that they're voting for Joe Biden. So that's that personal connection we see in relation to the policy, and it's part of what's reshaping the Sun Belt and putting some of these states in play, maybe reshaping the overall electoral map, Margaret.
But what we've been hearing is that people are viewing this as sort of a vote against Trump rather than enthusiasm for Joe Biden. Is it enough for Biden to be this opposition candidate?
I think that's a central question to watch going forward. When you look at people who say that they are for Donald Trump, they are voting for him because they like him. But a comparatively larger percentage of Joe Biden's voters say that they're voting for Joe Biden to oppose Donald Trump, to vote against Donald Trump. So that's a dynamic, sort of a classic case in any election. Is it enough? We'll have to look and see. It also might translate into enthusiasm. The president has very enthusiastic supporters. And I would add this too, as we start to look at the economy. Well, that's a place that the president still does at least relatively better on the economy than he does on handling COVID, Margaret.
Well, that's interesting because, of course, COVID and the economy are intertwined because the economic crisis has been triggered by that. You have this skyrocketing jobless rate. Joe Biden this week came out and made a big economic speech saying he can be the guy to best rebuild the economy. Can President Trump make the argument that is more convincing to voters that he can do what he did before and do it again, as he keeps saying on the campaign trail?
Well, so far in these states, slightly more feel that the president's policies would help the economy recover more so than hurt it or hinder it. So that's one thing, again, relative to his handling of COVID that is in his favor. And the other part of this is that, by and large, voters across the political spectrum say that the economy is still a top issue. Yes, COVID is very important for Democrats and their vote, for Republicans less so, but all partisans agree that the economy is important, so that as well could be central going forward, Margaret.
You're a data guy. There's not a lot of data about what it looks like to try to go out and vote in the middle of a pandemic. The president says he's against mail-in ballots. Do we know what this election's going to look like in terms of turnout?
Well, the indications we get from having watched these later primaries, where we saw people by the tens of thousands requesting mail ballots, turning in mail ballots, and then as polling places were forced to close because they couldn't find enough poll workers, well, that led to longer lines, people standing in line for hours in order to cast votes. If that happens again in November, and every indication is that it will, then the old line that it all comes down to turnout goes double or triple in these cases. I think it shifts the entire dynamic of this campaign and what happens if voters can't easily get access, can't easily get a mail ballot, can't easily get to a polling place. And I think as we watch the polls going forward, this is an election about intensity and access.
We'll be right back. That's it for us today. For Face the Nation, I'm Margaret Brennan.